I asked a series of questions about the staffing in emergency departments at rural and regional hospitals in the months of July and August, and whether a doctor or a trained emergency department nurse practitioner was rostered on and available to see patients all during the day and during the night. And the answer or the non-answer I received: this information is not centrally available. Or in other words, the Minister and his senior advisors have no way of knowing whether emergency departments are properly staffed and are able to operate, or are forced to put notices on their doors, like the one on the door of the Deniliquin Hospital on the 4th of August, when a mother presented with an ill child to read, "Our emergency department staff and doctors remain under pressure. During this time, there may be a few times when we do not have a doctor and or an emergency department nurse practitioner in emergency department all the time." And so photos of the child's injury were taken by a triage nurse, sent off-site, information sent back so that some treatment could be offered. But a trained emergency department professional was not available to see that sick child. The Minister in his answer reminds us that recruiting health services professionals to regional, rural and remote areas remains a challenge across the country. Agreed. Reminds us of the commitment to attract and retain staff in rural and regional New South Wales. Yet he cannot provide information about how these services are operating, when they are operating, and what staff are available. Without this information, how do we know who needs to be recruited, for where and to fill what positions? It doesn't matter what pay increases are offered in the budget unless we know who needs to be employed, where and to do what. Parents, of course, know when they turn up at understaffed hospitals. The Minister does not understand regional New South Wales and doesn't seem interested in finding out the facts. I encourage the Minister to understand the problem so that real fixes, rather than photos of band-aids, can be applied.